Blog Talk Radio.
Carol the Coach. Sex, love, and relationships. We talk about it here.
Carol the Coach. Compassion with contemporary relevance.
I am a psychotherapist. I can be your personal life coach, and I can help you with your issues. There are no problems too small or too big. You can talk about anything.
Speaker, columnist, radio TV host, and commentator. Carol the Coach brings messages of wellness and empowerment within reach of everyday people every day.
Almost 5 years ago, I lost my soulmate in an accident. He was killed in a plane crash. Life just, for me, has seemed to stop.
There are groups all over the city. I teach one. It is a specific way to start thinking so that you shift how you see the world, which then shifts your energy, and then you feel better and you actually see things differently.
Carol the Coach. Always available too at carolthecoach.com.
Now I've got Russell on the line.
I'm 47 years old. I'm a truck driver. I am married. I have a wife in San Francisco.
Okay.
I haven't been home in 6 months. My thing is, I don't know if I have a sex addiction or what the problem is. Why do I want what I can't have? And as soon as I can have it, I don't want it anymore.
You're right on target when you say, I don't know if I have a sexual addiction. Well, guess what? Yes, you do. And you know what? That's my specialty, Russell, so you're at the right place. Continue.
I meet women online, and I'm in a different part of the country. I travel all 48 states, so I love sex.
I hear self-esteem issues. You never felt good enough, and you didn't feel like you were getting what you should have then, and you're reenacting that now. Do you want to change that about yourself?
You get what you need.
I got an interesting email this week. He says, thank you for taking my email in question. My girlfriend and I listen to you on the radio, and she respects your opinion.
She respects your opinion so much that she wanted to know, Carol, if there was any hope for us. You see, this is an addict who has acted out time and time and time and time again. And he's been with his girlfriend for approximately 5 years. He doesn't seem to be able to connect with her. He won't commit to her, but he does see her. And she's frustrated. She wonders why she's settling for the crumbs. And on top of that, he acts out in between their good times. What should she do? Well, I deal with 3 types of sex addicts. One is the isolated sex addict who doesn't date anybody at all and uses their relationship with prostitutes, escorts, strip clubs, pornography, to occupy and fill his time. 2, I have sex addicts who absolutely have not committed to anybody, but they are seeing people in relationship. That's this email that I got. In other words, they're together. They are spending time dating, being together, even living together on and off, but he won't commit to her. And she's wondering why they can't get married. Now, this would be a normal question, except for this person is in love with a sex addict. So in addition to the fact that he can't commit, she probably thinks he's a commitment phobe, he does not and is not able to make the commitment to be exclusive. Okay. Now, personally, I think that's a good thing because he's very, very sick. And, if they aren't together in a relationship that's committed, that's actually it's a much better situation for both of them. And then the third kind of partner issue is the man or woman who's married to a sex addict. They've committed their vows, and they don't know what in the heck to do. All right. Now, personally, I want to tell you that if you're dating somebody and you're wondering if that person is right for you, let me just go over the 5 stages of dating. Because interestingly enough, there are 5 stages. The first stage is attraction. And most people that are listening to this show understand that when you're dating somebody, you either are attracted or you're not attracted to that person. And attraction is very, very important because when you're dating somebody, you're moving in and out of that stage. The second stage is something called uncertainty. And in a healthy relationship, there is always that second stage where you go, gosh, is this person for me? Should I just be dating this person by him or herself? Do I need to explore other relationships? Is this relationship going to go any further? And so when you're dating, it's not uncommon to move in and out of uncertainty and attraction. And that's a normal state initially, and then it should settle into the third stage, which is exclusivity. Now, when you're exclusive with somebody, you are committed. Oh, it's not the kind of committed that till death do you part, but it is the commitment that says, I'm going to stop looking for anybody else, and I'm going to focus on this person, and I'm going to decide, is he or she marriage material? Now, I can already tell from this woman that she wants her relationship to be marriage material, and yet you heard me say that he has slipped or relapsed several times while they were together. And in addition to the fact that he can't seem to stay clean, he can't seem to stay sober, he can't seem to stay recovered, he also is not committing to her. Well, that's a problem. That's a big problem because if he's not committed to her and he's not doing the work that it takes to stay in recovery, that's a dead-end street. And so she really needs to be looking for somebody else, somebody who's healthier. The only reason she should stay with him is if he's working a good, strong recovery program. Now, the complicating factor is that sex addicts typically have intimacy disorders. They have trouble really committing and being close and doing what it takes to dive deeper into the relationship. So lots and lots of partners have difficulty getting that sense of fulfillment that you get from being in a one-on-one exclusive relationship. And I got to tell you, I said the first stage was attraction, the second stage was uncertainty, the third stage is exclusivity, and the fourth stage is engagement. The fifth stage is marriage. So I don't know if my listening audience is single or married. I don't know if my listening audience is single or engaged, or maybe at least exclusive. But what I do know to be true is that sexual addiction is perhaps the toughest addiction to fight. And if somebody has some slips or relapses, that is understandable. But what you should be looking at is your partner's recovery program. Now, it's not up to you to manage, monitor, or work on your partner's recovery program. But let's face it, if you love somebody, you can from afar, decide, is my partner working a solid recovery program? Because Patrick Carnes says you need to do that to be able to know whether there is hope for a normal lifestyle. You see, what we know to be true is if somebody works a recovery program and they follow at least 8 of the 10 recovery tools, they will likely stay in very good recovery. And then that relationship is worth investing in. But if they're not, prognosis for them is poor, because addicts are not typically strong enough to do it by themselves. They need the support of fellowship. They need the support of a 12-step program. They need the support of perhaps an online group like Recovery Nation. They need to have a mentor or a sponsor. They need to do their readings. They need to do the 12 steps. They need to develop fellowship. Those are the first 5 recovery tools. Then they need to be involved in a counselor that has expertise in sexual addiction or partner trauma. They need to be involved in a group therapy experience with other sex addicts. You know, when I talked with Patrick Carnes and I asked him, do I need to start a therapy group? I had run over 2,000 women's groups, not for sex addiction, but just in general. And he said, absolutely, Carol, that's imperative to good treatment. And so I started one, and I know exactly what he's talking about. I mean, it is in a therapy group for sex addicts where addicts get to really check in with each other about what has helped them and what they need to continue working on. They hold each other accountable. They do it with compassion and empathy. And it's just an experience you can't have anywhere else. In addition, they do their reading of recovery materials and spiritual materials. They may pray or they may meditate. They have the proper filters and accountability tools that help them stay on track while they're developing new neurocircuitry in their brain. And then they are working on healthy sexual and non-sexual behaviors, kind of the outer circle that we talk about. So those are the 10 recovery tools that an addict needs to follow. And if you love somebody who has sexual addiction, you need to make sure that they're following those kind of routines, because as Patrick Carnes says, you're probably not strong enough to weather this addiction by yourself, and you need a committee. And the committee includes a good therapist, good support groups, incredible transformation work that occurs in 12-step meetings or online recovery groups like Recovery Nation, and doing all the work that involves transforming and evolving into the person that you want to be. And I can't say enough for that kind of work, because when you work it, it does work, and you become the best person that you can be for yourself and for your partnership. Now, tonight, I am so excited to have a doctor who is actually an expert in working with sex addiction as well as partner trauma. And I can't say enough great things about my expert for tonight. We've wanted to get this person on the air for a long time. And so, if I can, I want to introduce our listening audience to Honor Ashbaugh MD, who's a primary care physician who has devoted her life to being a therapist treating sex addicts and partners. So, Dr. Ashbaugh, welcome to the show.
Thank you so much, Carol. Thanks for having me.
Absolutely. I am sure our listening audience is saying to themselves, oh, my goodness, you've got a doctor who not only still specializes in medical management, but also treats addicts and partners. Tell me, how did you decide to get involved with the expertise of sexual addiction and partner trauma?
Well, it sounds pretty intriguing to most people because I think I'm one of the few medical doctors that's doing what I do. But I was a primary care physician, and I practiced here in Boulder, Colorado. And I found it very difficult to practice medicine the way I wanted to, with the time limits and the constraints that were put on us with government regulations and documentation and things like that. And although I was an internist, one of my specialties was treating mood disorders and anxiety disorders. And it's really hard to do that when you have a very limited amount of time with patients. And with 10 to 15 minutes at a time, it's really hard to adequately treat somebody or counsel somebody who has depression. And so I decided that I couldn't do it anymore, and I decided to create my own career. And since I do have a history of addiction myself, I'm in recovery for alcoholism for 12 years. This is, I had an opportunity with somebody here in Boulder who needed a partner specialist, and that's how I got interested in it.
All right, so you had a personal interest in addiction, and you decided you couldn't do the medical establishment 15 or 20 minutes per patient and really be effective. And so you broke out of that mold. And so how did you first hear about sexual addiction? Because I think, didn't you get your training in sexual addiction before you went into partner trauma?
Well, I am actually a CSAT candidate right now, and I will have completed my training in March. And I am a certified clinical partner specialist as well. So I actually got that first. But no, I have a partner here in Boulder who needed someone to work with partners, and his name is Dr. Michael Barta, and he owns the Colorado Sexual Recovery Center. And he was looking for someone to come on board with him and help him with sex addicts and partners both. He was very busy, and so I thought that might be a good fit for me, and I could still practice medicine and use my medical skills. It seemed like a win-win situation, really, for both of us.
Oh, absolutely, and we think a lot of Dr. Barta here on the show, and have had him on several times. He's so good with attachment theory and with trauma and abuse. So yeah. I know you ended up in the right place, and what an adjunct you must be, because not only do you work with partners who are experiencing all sorts of anxiety and post-traumatic stress and complex post-traumatic stress, but you also work with sex addicts, both from an emotional and a medication management perspective, correct?
That is correct, yeah. So we are really lucky to have the ability to keep our patients in-house if they need evaluation for an uncomplicated mood disorder or anxiety disorder. And, you know, I don't know how it is across the rest of the country, but in Boulder, the wait to see a psychiatrist is, 6 to 9 months. And for a lot of people, that just that isn't going to work if they're in crisis. And so having a licensed and board-certified internist is really, really helpful because we get to keep it all in-house and take care of our patients ourselves.
Absolutely. Now, explain to me a little bit about your training with partner trauma. I mean, you and I are both APSAT certified, and we believe in a model that really treats trauma experienced by partners. Explain to our listening audience what the multidimensional partner trauma model is and how that applies to APSATs.
Well, I really was interested in getting trained in the multidimensional partner trauma model, and this is a model that was put forth mainly by Dr. Barbara Steffens, and she developed, or rather founded, the Association of Partners of Sex Addicts Trauma Specialists. It's a mouthful, but we just call it APSATs. And her approach to treating partners was an assumption that partners are actually suffering from a trauma response related to or secondary to a betrayal trauma. And this is a lot different than some of the old models where partners were labeled as co-addicts and essentially told that they were part of the problem. And I really wanted to bring the partner trauma model to the Colorado Sexual Recovery Center and also to our new 14-day sex addiction treatment program that we have, just so that we could really educate the addicts about the partner trauma and the relationship issues. But it's been really rewarding just working one-on-one with the partners as well.
Well, okay, and tell me a little bit about this program. It sounds very unique.
Are you referring to the 14-day program?
I sure am.
Yes, so this is a new treatment program for sex addiction that Dr. Barta and I have started, and the company or the name of the program is called the Begin Again Institute. And this is a 14-day residential treatment center for male sex and porn addicts. And it's an intimate group. We typically take no more than 5 or 6 people at a time. We have the guys stay in our beautiful property on the Rocky Mountains for 2 weeks. They have all their meals paid for. They have accommodations, and they go through a lot of psychoeducation, group therapy, individual therapy, yoga, wilderness therapy. It's just really a cool experience, and we've been wanting to start this for a while, and now that we have given birth to it, so to speak, we just can't wait to make it more easily available to others around the country.
Well, that sounds wonderful, because obviously it gives the addicts real time to invest in themselves and work through some of their own personal issues that have probably contributed to the problem, perhaps even some sexual trauma reenactment that's occurred in their lives, and to transform, to find out what they need to do to get stabilized.
Yeah, Carol, we can't tell you how excited we are about this program. It's a wonderful opportunity for the men that come in. You know, sex addiction is an intimacy disorder, and a lot of these men, this is the first time that they've actually been able to be intimate with somebody else. And so the magic of the program is really all of the men staying together in a house for 2 weeks and being able to learn to be vulnerable and intimate and authentic with each other. And the results that we have seen are just amazing, just complete transformations. And we understand that a lot of people either A, can't afford to go to a 30, 45-day or even 90-day treatment program. And so, and also a lot of people don't have the time and they can't take off that time from work. And so we felt like the 2-week program would be a really good option. And we call it an intensive outpatient program with on-site accommodations because it is very intensive. and we look at the cause and the reason the addiction occurred, and we look at the partner trauma and the relationship, and we use the task model also in a behavioral approach. So it's kind of a three-pronged approach, and the partners of these men really like it because of the partner focus. We're very partner sensitive, and so the partners really like it. We spend a lot of time talking about how they've harmed their partner and accountability and things like that.
Well, and I have to agree with you. You know, certainly if you can afford a 30, 45, 60-day program, that's a wonderful opportunity. But for those people that can't or they can't take off the time, this sounds like the best of both worlds. You're getting a concentrated amount of time to develop that empathy, vulnerability, and intimacy that you need. And, you know, everything you just mentioned is what happens in my groups that meet once a week. So I can imagine if these guys were together for 2 straight weeks, how close, how intense, and how motivated they would be to really delve into the personal issues that have contributed to sexual addiction. It is very, very exciting. Now, let me ask you, how often do you prescribe them medication?
So this is the little caveat for our 2-week program is that it's not an inpatient medical program. So we do not do any prescribing in our program. So people that come into our 2-week program need to have, if they have medical conditions, they need to be stable. So we don't bring medicine into this program. It's essentially an intensive outpatient program with on-site accommodation. So we don't have, people, giving medications out or making medication changes. That being said, the men do leave with a treatment plan, which is very thorough, and a lot of times this happens to include a recommendation from me in terms of ways that they can improve the treatment of their mood disorder or their anxiety disorder, or even recommendations to be evaluated to start on medications. So we try to keep the medical aspect out of it, just because we really want to focus more on the psychoed, the trauma backgrounds and why this occurred, and then the behavioral approaches to stop the behavior and to learn about the partner trauma that's occurred.
Well, got it. Okay, so that is not the focus of the 2-week program. And again, the name of that program in Colorado?
It is Begin Again Institute.
Begin Again Institute, and they can find out more about that by going to www.beginagain.
That's correct, beginagaininstitute.com.
Got it. Now, you have made it your mission to help partners of sex addicts, and I'm curious, obviously I believe that you and I are both part of the best partner training in the world.
I agree,
but
yeah.
Absolutely. What do you think the benefits are of having a medical degree while you're treating partners?
Well, I think it's very, very important, and I think it offers a really unique perspective. The trauma that's associated with betrayal trauma, the trauma responses can be, as you know, quite severe, and it is not uncommon at all for these partners to have times when they may need to be evaluated by a physician for treatment of a medical condition. And this isn't all partners, but there are certainly a good number of partners I find that have a clinical depression or an anxiety disorder, or certainly insomnia secondary to anxiety. And we all know that if you don't get enough sleep, it's going to be really hard to heal from and, to make it through such a traumatic and difficult event.
Well, 100%. And so what do you think are some common symptoms that partners suffer from after they've discovered that their loved one has sexual addiction?
Right. So such a hard time, and as many stories as I hear from partners, they still break my heart every time, just the pain that they go through. And I always make it really clear that we need to differentiate between feelings and symptoms, because a feeling is an emotion, and we know that those can be across the board with partners, and they can roller coaster ride, pretty much is what a lot of them describe it as. But a symptom is more of a physical display of some sort of an illness. And so what I typically see most commonly with partners is anxiety, insomnia, depressed mood, fatigue, oftentimes intrusive thoughts and agitation, irritability, forgetfulness, and also obsessions or ruminations. And the nightmares are also really common too, and that goes along with the intrusive symptoms. But these symptoms they're really common in partners, and the important thing I want, for people that treat partners is to know when to be concerned about these symptoms and when to refer out, just to know when they may need some more help, because I'm not a doctor who advocates for suffering, and I always want to give people permission to seek other help if that's something that they're comfortable with. And certainly not every partner requires an evaluation for possibly being put on medications, but there are a lot of partners, I think, that are suffering who would basically really benefit from that but haven't had that opportunity.
Well, absolutely, and I know that hypervigilance, that fear that their loved one is going to get over on them again or is going to act out and they're not going to know, keeps them up at night, causes them insomnia. It just doesn't allow them to relax, and that after a lengthy period of time does horrible things to both the central nervous system as well as to the amygdala. That amygdala is working overtime, isn't it?
Absolutely, and it can be exhausting. And, the process itself, getting through that crisis, which I like what Vicki Palmer Tidwell, or Tidwell Palmer rather, says in her book, Moving Beyond Betrayal. She calls that period of time tolerating the intolerable. And that's really what it is. And so we know that sleep deprivation is used as a torture mechanism, right? It's a way that you can actually torture people. And so if you can't sleep, how is your body going to heal? And so it might seem like a little thing, but it can really lead to some serious problems if it's chronic and if it's not addressed.
Absolutely. Now, let me ask you, because partner trauma is in itself very, very difficult. And then if you've had a history of abuse or previous betrayals, if your parents have had multiple divorces, that can turn into post-traumatic stress and or complex post-traumatic stress. So could you explain to our listening audience the difference between both PTSD and complex PTSD?
Well, post-traumatic stress disorder is, when we go through trauma, we have what we call an acute trauma response. And this is in the DSM-5, and it really includes a lot of the symptoms that you would find in post-traumatic stress disorder. The difference, however, is going to be the period of time that the symptoms have been present. And so for PTSD, the symptoms have been present for more than 4 weeks. And when you think about it, that really isn't very long. And a lot of partners do have symptoms that go on for more than 4 weeks and therefore have post-traumatic stress disorder. And post-traumatic stress disorder is, we like to think of it, or people like to think of it as happening to veterans or people who have been through watching someone get killed or natural disasters or things like that. But that's really the big T, as we call it. The little T's, the psychological things also can be really, really devastating. And betrayal trauma is something that causes people to have PTSD. And I think that Barb Steffens found in her study that 70% of partners actually met all the criteria for PTSD. And, this includes things like repeated and unwanted memories or intrusive thoughts, nightmares, disturbing dreams, things like that. There is a hypervigilance in these patients. They are very much on edge and waiting for the other shoe to drop. There is avoidance, and these partners are trying very hard to avoid any kind of memories or thoughts or feelings about the stressful experience, and also trouble remembering, having amnesia. And last but not least, there is a lot of negative cognition or depressed mood, dysthymia, things like that. And so it's a complex diagnosis, but the time is what differentiates it between an acute trauma response. Now, complex PTSD, on the other hand, is a lot more difficult to treat, and it's a lot more intense. And we tend to see this in partners who have a lot of ongoing trauma, or they have repeated traumas. And this, I like to use the example of a staggered disclosure, where every time they learn a new event, they become traumatized, and then as soon as they begin to get well again, they are dropped with another traumatic event or another discovery. And so the complex trauma is a little bit more difficult to treat. It's more severe, and like I said, I like to think of that as something that is found in people that have ongoing trauma or trauma over a long period of time.
Well, that was a very good description, because it is a very complex disorder to have either post-traumatic stress or complex post-traumatic stress. It means that you've had a lifetime of betrayal or issues that have caused you a lot of concern. And so our partners oftentimes get labeled as co-addicts because there used to be an old school of thought that believed that, well, if you had this background, then you attracted the same thing into your life. And you and I both know, for all of our partners that are listening, that we do not ascribe to the co-addict model. We recognize that partners did not draw in or magnetize these type of clients. It wasn't something that was sick about them that created this issue. They fell in love with a man or a woman that became a sex addict. Wouldn't you agree?
Yep, absolutely, Carol. I mean, they are not to blame. I like to say they are innocent bystanders in the path of destruction that is caused by their partner who is acting out sexually. They are innocent bystanders, and no, the co-addict model, I've seen a lot of trauma from people that have been labeled as co-addicts, And that's one of the reasons why I think that the multidimensional partner trauma model is so wonderful, in that we finally get to see this for what it really is and give these mostly women, but sometimes men, some hope.
Yeah, and certainly when this kind of situation has occurred in the life of a partner, they may have certain medical conditions that needed to be treated medically, that need to go beyond a therapist. So, first of all, how do you evaluate partners for symptoms requiring medical treatment?
Well, all of my partners, since I'm a physician, I really like to have all the data that I can have. And so all my partners go through an extensive history from me, and it includes the history of what's happening now, the past medical history, their family history, and their social history. And these things are all important. So the history is something that's where I get most of my information, just by asking a lot of thoughtful questions and just being curious about what's going on. But the other thing that I will use that is very helpful for me is screening tests, and there are a lot of different types of screening tests for different illnesses. We like to use the Beck Depression Inventory to screen for depression. For generalized anxiety disorder, we like to use the anxiety scale, which the DSM-5 includes the DSM-5 criteria. So the screening tests are helpful for us. But more than anything, I think that the important thing is, what are the symptoms, how long have they been going on, and how are they affecting the partner in terms of her daily activities, whether it's occupational or social or familial and parenting, because it's possible to have symptoms of depression when you're a partner and you've just been through discovery and not meet criteria for a major depression or something that requires medication. So looking at the duration of symptoms and how they're affecting the partner are really, really important criteria. But the other thing is that I really want to point out is comfortable with even thinking about taking a medication. And so it's certainly something that we don't push on people if that's not something that they want to do or believe in. If I think that they would benefit from the medication, I like to tell them what kind of results they would expect, because a lot of partners, I think, are suffering when they don't need to be suffering.
Well, absolutely. And, as much as I know there are lots of men and women that don't like medication, there are many men and women that want to do it by themselves, and medication is absolutely necessary to balance that chemical imbalance that's occurred because of the multiple traumas. So you then evaluate symptoms and decide, would a medication be valuable?
Correct.
All right.
Correct.
And after you've determined that, what are the medical conditions that can occur in partners that can be treated medically? Would that be anxiety? Would that be depression?
Yeah, so, Carol, most of it is anxiety and depression, and also insomnia. And you can see how it would be really tricky, because these are things that most partners are going to have anyway, even if they don't meet criteria for a clinical disorder. So it's basically knowing, when it's crossed over the line and when we may be able to help them with a medication. But yeah, the ones that we usually see and what I typically treat are depression, anxiety disorders, and insomnia. those are the ones that we see the most commonly. And with insomnia specifically, you wouldn't believe how much better people can feel just from getting a good night's sleep for a few nights in a row. It can be life-altering.
Well, absolutely. One of the things that I know to be true is that so many of my partners describe consistently feeling like they're in a fog. And then when I check on their basic needs, are they eating properly? Are they getting enough sleep? And are they able to rest and relax? All three of those are usually very, very affected, with sleep being the most important. So yes. I could see where, medical treatment would mean giving them some sort of medication to help them sleep. And I happen to know that lots of clients are worried about sleep medication. They don't want to get addicted. There are certain sleep medications that are typically more addictive, like Ambien. And then there are some sleep medications like trazodone, which are old antidepressants that have been very effective in sleep. So I'm sure you really evaluate your patients and decide what fits them the best.
Absolutely. I'm impressed with your knowledge of all those medications, actually. So we do. There's several different categories that we can use. The first thing that we want to do, though, before we give medications for sleep is we want to make sure that the sleep disturbance isn't a result of a depressive episode, a major depressive episode, because it would be treated a little bit differently in those cases. But for the most part, if a lot of people are worried about getting addicted, and as you know, the benzodiazepines are the things that we worry about the most. But I like to reassure most of my clients that the benzodiazepines that I would use on a short-term basis are probably going to be looking more like clonazepam, which is a long-acting benzodiazepine. And the addictive potential in those longer-acting benzos isn't as great as it is with the shorter-acting ones such as Xanax or Ativan. But benzodiazepines are a really good choice. Like the clonazepam is an excellent choice in somebody who has depression, and we're treating them with an SSRI for their depression, and then we use the clonazepam as a bridge until that medication basically kicks in. But some people can use melatonin and do well. Some people, I'm not a big fan of Ambien just because of the adverse effects, and I've just seen in my medical career too many people that act out in the middle of the night, get up and eat or walk around and don't remember it, and I just found that it's not my favorite one. But the trazodone, which is, as you said, an old antidepressant, can be really effective for sleep. And if someone is depressed as well, then we can kill two birds with one stone. So a lot of different options out there, and we try to tailor it to the specific partner in terms of which type of treatment would be best for them.
Well, absolutely. So let me ask you, as a partner, how would one know whether they should seek treatment from a physician? And for a lot of my partners, as you indicated earlier, there just aren't enough psychiatrists to go around. So what would you advise? Would a primary care physician be good, or do you think they should go in for the psychiatrist even if they have to wait 3 months to get in?
Well, so what I usually recommend, the main thing is someone has to know to tell them that they could benefit from one of these medications. And so we hope that is the therapist. Now, if people aren't seeing therapists, then what would they look for? Well, it would look for, being persistently, it depends on if we're talking about depression or anxiety, but if these symptoms are lasting for a long period of time and aren't getting better little by little as they start to move away and heal from the discovery, then that would be concerning. If it's affecting their daily life, if they're unable to work, if they don't enjoy doing things anymore, if they can't sleep, if things have been going on for a duration that, for depression, I mean, it's really a short period of time. It's only for over 2 weeks. But certainly a primary care physician is oftentimes the best bet if you can't get in to see a psychiatrist. I mean, as a primary care physician, I would say that I treated depression more than any other illness. So a primary care physician certainly knows how to treat depression and anxiety, insomnia, and that would be a perfectly acceptable first stop for somebody who needed to be evaluated.
Yes, good point. And, with the help of a therapist, hopefully the physician and the therapist can work together so that everybody's fully aware of the symptomatology and the stress level that the partner is experiencing. Now, what kind of things can a partner do that's natural to help their symptomatology? What do you advocate either to increase the likelihood of success along with medication, or to do instead of using medication?
Well, that's a really good question, because it would be nice if we could prevent people from needing medication at all. Of course, there are going to be people out there who are predisposed to depression or anxiety disorders who may be able to do all of these things and do them really well, but still not get better. But the things that we suggest, it's all around self-care. And the main thing is going to be getting adequate sleep, at least 7 to 8 hours a night, eating nutritious and healthy food, and exercise is going to be huge. Exercise has been shown in studies to sometimes work as well as an antidepressant in terms of treating people that have depression. Some of the other things that we recommend are things that hopefully therapists are telling their patients. Find someone to connect with, whether it's a partner support group or a therapist or a clergy member or just a safe friend or family member to talk to. It's really important that these emotions can get processed. So that's really important. And also healthy affect regulation or healthy self-soothing mechanisms are going to be of the utmost importance. So I like my partners to stay away from things like alcohol and marijuana in these really difficult times, because it can be detrimental. It can make their symptoms worse. Plus, that's not, in my opinion, a very healthy self-soothing way to get back into your window of tolerance. We work a lot with the window. And so whether this is exercise or taking an hour to read at night or taking a nap or doing parasympathetic activities like deep breathing or meditation, yin yoga is something that we really like. Those are all really healthy self-soothing mechanisms or way to regulate your affect without, relying on survival behaviors, which would include, drinking and drugs and avoidance. So those things are all. Go ahead.
It's very interesting you say you give those recommendations, because I always say connection is the antidote for both sexual addiction and for partner trauma.
Absolutely.
And there are a great online groups for partners who may not have the availability of getting to an S-Anon group or a COSA group. And so there's really no excuse for you as a partner not to have a group of women that you know have been through what you've been through and can actually support you. And I know, Honor, that it's so important for partners to have safe people to talk to, and oftentimes they're afraid to talk to their parents or their siblings or their neighbors or their church friends because they're afraid of judgment, and they really want to stay as neutral as possible while they figure out what they want to do for their lives. So finding somebody who's been through the same thing means that they probably are not going to experience the level of judgment that can accompany the normal person.
I couldn't agree more. I couldn't agree more. I mean, connection is, right, that's the antidote for trauma. I mean, in trauma, that's our natural inclination is to connect. And so, a support group is absolutely, I believe, necessary. That's where healing can take place, and it's hard to find people who aren't judgmental of partners in these situations. And, you know, none of us know what we would do if we were ever in that situation of being betrayed by somebody. And offering, you know, judgment or advice to people in that situation is really unfair. And as you said, you know, partners can't make those decisions when they are in that crisis stage. And sometimes it takes them 6 months to a year before they can make any decisions. And so having someone that is non-judgmental and who they can talk to, who's not telling them whether they need to stay or go, but just to empathize and hear them is so, so important.
Well, you got it. And it's interesting because any person who's involved with addiction, whether it be drugs or alcohol, sex, they are supposed to really lay low and not make any immediate changes in their life. And the same thing goes for partner trauma. Now, certainly, we might recommend if they're too activated and they just don't feel safe, a therapeutic separation. But we really encourage partners to see if they can't stabilize and work through some of the feelings so that they have the adequate resources and judgment to know, what do I do next? And giving it a year is a good amount of time to kind of sift through that, do reading materials, get to groups, exercise, and find a mentor who can actually listen and provide feedback when necessary. And anybody who is listening to this show who is a partner, they can always go to the APSATS website, which is APSATS, and look for a specialist that has this kind of training. There are two types of training. One is training and versus certification. And both Honor and I are certified. Honor, you got certified, was it 2 months ago?
Yeah, really recently.
I know. I'm so happy to have you on board. And I'm
well, I am too. Thank you.
Yeah. Well, how long did it take you to get your certification?
I did the training in Houston with Barb Steffens and Dan Drake, who they're both just fabulous. And I did that in November of 2015 and just got certified last month. So a little over a year. You know, I've been very, very blessed in that I walked into, well, my business partner has a booming practice, and so I walked into having ample clients, and I got baptized by fire, and I think that's the best way to learn. But it's been a crazy, great year, and I'm really happy to have the certification under my belt and to be able to help people now.
Well, and they are lucky to have you, too. She is referencing, again, Dr. Michael Barta, and the name of your organization is?
The Colorado Sexual Recovery Center. And our 2-week treatment program is the Begin Again Institute.
All right, and if we have people that want to contact you directly, either to get some advice or to find out how they might get to work with you, how can they go about doing that?
The best way to do that is to reach out to me by email, and I would love to hear from any listeners that have any questions. My email is really easy. It's Dr. Honor, which is DRHONOR @gmail.com. And I welcome any comments, any questions, any way I can be of help or support. I'm happy to do so.
Well, thank you so much. And now I can see that we have to end the show. So do you have any parting words for our listeners who might be sex addicts and or our listeners who are partners of sex addicts?
Well, for the partners, I just say hang in there, get the help that you need. It's not always going to feel like this. And for the sex addicts, I just encourage them to have the courage to make that first phone call. And, at the Colorado Sexual Recovery Center, we're here, and we see people from all over the country for our couples intensives. And our 2-week program is up and running, so we would love to be of service to anybody and just keep on plugging through it.
Well, Dr. Ashbaugh, thank you so much. I so appreciate the information about medication. You are a dream to have gone from medication into therapy and to be able to do them both. I love a doctor who's not willing to settle for the medical model when it doesn't meet the needs of the patients. So thank you so much. And we got to get you and Dr. Barta on to talk about your 2-week program at length, so don't forget.
We would love to. Yeah, Carol, thanks for having me on. I really appreciate it. It's been awesome talking with you.
You too, and have a great night. I wish you the best.
Okay, Carol, take care.
Meet soon.
Thank you. Bye-bye.
Bye-bye. So again, I was talking with Honor Ashbaugh, and she is a medical doctor who has made it her mission to work with sex addicts and partners. And she said she's completing her CSAT. For anybody who's listening, that means she's going to become a certified sexual addictions therapist, and she also is working clinically with partners because she is APSATS trained. And again, I thank you so much for listening to the show. This was the first time we've ever had a medical doctor on talking about medication. It's always exciting when we have a new topic because you and I both know it takes a village to work through this issue. I'm honored and blessed to be working with you. I look forward to seeing you next week, same time, same place, for more Carol the Coach. And what I know to be true is that there are always ways that we can help each other if you go in for the big ask. And what I mean is you've got to be able to ask the right questions that make your life much more bearable and much more rich and exciting. Next week, I have Rick Eisenberg on, and he's going to be talking about the center that he works for, as well as the research that he's doing with AFAR. So we'll look forward to talking with him. As I say at the end of every show, there's only going to be one of you at all times, so I fearlessly want you to have the courage to be yourself. And I look forward to talking with you next Monday at 9 o'clock p.m. Eastern Standard Time. You have a great week.